right, good evening, everyone. Thank you again. My apologies for the confusion and the switch. We appreciate you switching channels for us this evening. Thank you for joining us. We are going to wait just a minute here for our interpreter to switch channels as well. She was waiting for anyone else who may need interpretation to be able to receive the message that we have switched channels. Again, we will get started. Please note that we will be recording the meeting tonight. We are not going to record the Q&A session to protect your information should you choose to be on camera. But we will be recording the presentation this evening, and we will be sharing that out to other childcare owners and operators as requested for communication and information. We also realize that there has been an abundance of news today related to public health guidance as it relates to COVID-19. Know that we are working as rapidly as we can, and I know my co-partner tonight in presenting will be able to relay some of that information for you as well. Great. Again, thank you for joining this evening. Welcome to our what has become an annual town hall for our childcare owners and operators ahead of school starting and more students entering the safety of your care within your buildings and facilities. We wanted to give an opportunity to share a little bit of COVID data this evening, as well as some updates on some guidance that was shared by JCPH, guidance that we know was issued by CDPH, our state health department, and some information that was shared by the Centers for Disease Control this afternoon. So I'm going to switch slides here. This is our agenda for the evening. We will start with an acknowledgement of language justice. We will turn on our interpretation. We'll go through welcome and introductions, overview of our data, overview of the JCPH guidance for school settings, and then we'll have an opportunity for an open discussion, which includes primarily our infectious disease epi team, who I know many of you have worked with collaboratively over the last several years. COVID or not, you have had probably an opportunity to work with some member of the JCPH staff. So Yadira, are you on and able to present our language justice statement and we can get interpretation turned on for our community?
Christine, she has not popped over yet. Is she still in the other meeting that you can see?
She is not. All right, we're going to go ahead and get started. And when you see her get on, we can repeat and pause.
Thank you.
Yep. All right. So we are going to move ahead. For some reason, my computer is paused. So welcome and introductions. Briefly, again, let me start with introducing myself. My name is Christine Billings. I am the Director of Emergency Preparedness and Infectious Disease for Jefferson County Public Health. I've been with the health department for over 14 years now. I have seen a variety of natural disasters and pandemics, have been through the H1N1 pandemic and led the response to our COVID-19 pandemic, and I'm now leading the ongoing efforts into recovery as it relates to COVID-19 and all things infectious disease, emergency preparedness, and health communications for Jefferson County Public Health. With me tonight, we have Courtney Fox, and I will go ahead and let her introduce herself, and then we will get started.
Thank you, Christine, and thanks to everyone for taking time out of your evening to join us tonight. As Christine mentioned, my name is Courtney, and I am an infectious disease epidemiologist and registered nurse. I have probably talked to many of you over the past couple of years, and I, a little bit later this evening, will be presenting our latest school guidance for the upcoming school year, and will be around for any questions. So thank you again for coming. It's great to have you all here.
Great, thank you, Courtney. I see that Yadira has joined us. So Nikki, can we go ahead and get started with our language justice statement and turning on interpretation?
Okay, wonderful. So I think what needs to happen is everyone can go ahead and choose on the interpretation button. It's a little globe icon on the bottom toolbar. If you want to go ahead and choose either English or Spanish, whatever is the language that is the language of your heart, Yadira will go ahead and start walking through what our language justice initiative is and what she'll be offering tonight. Please make sure, even if you are listening into the meeting in English, please make sure you select English so that we can get going.
Great, thank you so much. Again, welcome to everyone this evening. My name is Christine Billings, and I represent the Division of Emergency Preparedness and Infectious Disease for Jefferson County Public Health. I am joined this evening by Courtney Fox, who is one of our infectious disease epidemiologists within our program. And so we will go ahead and continue with an update on the overview of current COVID data within the state of Colorado and within Jefferson County. So this is an update that we received from the state health department. Across the state, we are seeing that cases and percent positivity are slowly trending down across Colorado. Apologies for my dog. The 7-day moving average, this is the number that we use to kind of display on average over the course of a week, how many cases of disease are we seeing. That has dropped from a peak of 2,400 during our height of this wave that we have been in to a current rate of 1,135 cases. Hospitalizations are also slowly declining across Colorado. And if you know about the different strains of COVID-19, within Omicron, which caused our very large peak during the winter months of January and February, the BA.5 variant of Omicron has continued to outpace and sort of overtake all other variants of COVID-19. CDPH added this week to their dashboard a new subvariant of BA.4. This is BA.4.6. We are watching this. We haven't seen enough data on this new variant to know whether it's more severe or if it's causing, is more transmissible or has more immune escape, which means for those who are vaccinated, does that virus escape the protections provided by vaccine? Apparently, I'm going the wrong way. That's fun. All right. So this is a visual representation of the current case counts within Colorado. As you can see, if you follow my cursor, that 7-day moving average, this is the wave that we have just gone through. This was the wave, the Omicron wave during the winter months, where we had a very, very high rate of disease. This wave was long and drawn out. The modeling that I have seen shows that this wave will continue to decrease through the month of September into the early part of October, even with school starting. They put that into their model and more indoor activity occurring. And then it's expected with the return of what we call respiratory season that we will see another wave. We just don't know what that looks like yet. So our percent positivity, this is another metric that we use to monitor what the disease is doing within our community. That has continued to drop, which is a very good sign that we are seeing less disease. Usually the percent positivity matches that case count, so it is not unexpected that we are seeing a decrease in that percent positivity. This is a new graphic that I have not shown on a presentation before. This graphic, let me explain it a little bit. The gray boxes, so over here, if we're looking at the 0 to 9 age group, this gray box represents the percent population of the community that our 0 to 9-year-olds make up. And the colored bars represent how many cases they currently make up. Of all of the cases of COVID, our 0 to 9-year-olds make up 7.39% of the cases. We call this underrepresented. So we would expect, if we were going to match the percentage of the population that they make up with the percentage of cases, we would see a closer alignment of these two bars. So this is very good news for our youth as we head into the start of a new school year, that they have a lower than expected rate of disease when it comes to COVID-19. This is very positive news. It's also very encouraging that we're seeing a lower rate of disease in our older population, because we know that that population tends to have more severe complications if they become infected by COVID-19. So our current hospitalization, as we move into endemic COVID, meaning that we have moved out of the pandemic phase of our COVID-19 response into sort of a steady state of disease with COVID-19, we want to see that if we have a new variant or we have a spike in disease, that it doesn't greatly impact the number of hospitalizations caused by that disease. This wave right here represents the smaller wave that I showed you peaking in the middle of June. And as you can see, we saw a rise in hospitalizations, but we didn't see a dramatic rise like we saw during the initial phase of the pandemic, the Delta wave, so the Delta variant of COVID-19, nor during the Omicron wave. So this is really positive news. We still saw an increase in hospitalizations, but it didn't reach the really high levels that we saw with previous variants. As we move into that endemic state, the severity of illness is something that we will really watch to make sure that we have truly hit endemic state. This is another representation showing what the case counts are doing across the state of Colorado. The blue color shows that there has been a sustained decline week over week. The dark red shows that there's a steady incline. Various colors, so you can see that we have been in a steady decline for the past 5 weeks. Again, modeling shows that we will continue to decline through the months of September, and then it's anticipated that we will have another wave of disease, but it is unknown exactly what that will look like. Sorry for the rapid fire on the slide there. So bringing the data in a little closer to home, this data is from our Jefferson County Public Health website. Share the slide deck with you so that you have access to the links contained within the presentation. But this is available on the Jefferson County Public Health website on our COVID page. You are always able to access COVID related data and information as it relates to Jefferson County. Metrics that we follow, again, the hospitalization rate, we want to see this below 1, most certainly. The lower that number, the better. That test positivity, so how much illness is out there. And then we look at the percent of our population with one vaccine. We look at how many deaths there are, and we look at the number of Jefferson County residents who are currently hospitalized, regardless of where that hospitalization is. Excuse me. Excuse me, pardon me, I have a tickle in my throat. So with Jefferson County's COVID-19 trend line, we call this a trend over time line. So what does our case count look like over time? As you can see, our trend line is mirroring the state, and we are following right along with that sustained decline in cases. Hospitalizations, we excuse me, are in a steady plateau. We are trending down just a tiny little bit. We'll continue to watch this data. Again, apologies for the tickle. We'll continue to watch this data, make sure that it follows our sustained decline in case counts. When we look at severity of illness, we also look at how much death is occurring due to COVID-19. I always like to point out when I present mortality data that we define on our website how we define mortality data for Jefferson County. So please look at that, because when you're comparing between what's on our website and other websites, there may be a distinct difference in how this number is defined. So please pay attention to that information as you compare across websites. So in this section, we have potentially unreported cases, this gold bar. So also note that. But as you can see, we're kind of bouncing around below the 10 mark for the number of deaths that we have seen due to COVID-19. We had great weeks where we had 0 deaths reported. That was very positive news. This shows where Jefferson County sits in comparison to other counties within the state of Colorado. We are this red arrow right here. I know it's really tiny font, but we are sitting right in the middle of all of the counties across Colorado in terms of our rate of COVID-19 as compared to theirs. This is a relatively new metric. It was launched late spring by the Centers for Disease Control, and we've been utilizing this metric and messaging our community about it. You may have seen in June, we were moved up to CDC community level high. We have now dropped back down into CDC community level low. This will get updated tonight on the CDC's website. I've seen the preliminary data and we have maintained level low. And I would expect us to stay at level low through the end of September if the modeling holds true. Within CDC level low, that means that our case counts are below the 200 mark. And it means that our hospitals are not seeing any overburden due to COVID-19 admissions. This is a really great metric for childcare providers and owners and operators to utilize when they're making decisions about mitigation measures, decisions about mitigation measures within their buildings. We also wanted to provide a decent number of accurate data sources for you to utilize. These links will be active in the presentation when it's emailed to you, so please utilize those. We also have the COVID-19 alerts on the Jefferson County website. This is where we will message about changes in the CDC community level, and you can also sign up for other public health alerts on this section as well. So please check out this link and sign up for alerts if you have not already done so. So this is where I will turn it over to Courtney, who has likely got a better voice than I do tonight, and she will present the COVID-19 guidance.
Awesome. Thank you, Christine. If the only thing I'll ask of you is to advance the slides and you don't have to talk for a little while. So again, thank you all for coming. As Christine mentioned, some changes have occurred recently, as recent as this afternoon, in terms of CDC guidance for schools and childcares. So I'm going to go through some slides with the guidance information that was released to everyone via email earlier this week. This is also the guidance that is currently up on the JCPH website. So take all of this with a caveat that things may be changing relatively quickly. Our team will be getting together as soon as we can to sort of wrap our heads around the new guidance and to adjust ours as needed to more closely align with what our partners, both at the state level and the federal level, have come out with recently in the past 2 days. So I'm going to go through these slides. Please take note of your questions or your case studies that you'd like to share with the group. I think one of the things I'm most excited about for tonight is the potential for the learning that can happen among your peers. So certainly, as Christine mentioned, many of you have spoken to either myself or to my colleagues, Amy and Carla on the team in the past couple of years. Many of you have been through outbreaks with our team, and it's so nice to look through the guest list and recognize so many names. So know that this is all being presented in the spirit of collaboration and learning, but also know that in the ever-evolving response to COVID, things are certainly subject to change, and we will work together to get the latest and greatest out to you all as soon as we can. So I would say that the two trends that we're looking at for the upcoming school year guidance would be to sort of on the heels of what Christine mentioned with the CDC community levels. We want to lean on those levels more as we collaboratively determine what mitigation layers are most appropriate. Also, with the CDC announcement this afternoon, you will start to see sort of a break away from quarantines, from required quarantines in certain settings. So with that, the key points for this new guidance, some of these things have not changed. Most notably that positive cases of COVID are required to be reported to JCPH. That is a requirement that we have from the Colorado Department of Public Health and Environment. And the best way to report cases, as many of you know, is to email our team at the Health EPR Epi Liaison email address. Christine, I'm not sure if you can throw our email address in the chat. Hopefully most people have it, but that is absolutely the best way to report cases and outbreaks to our team. And we really, again, in the spirit of collaboration, want to make sure that we're all doing this collaboratively. So our team is always available for consultations, for advice. We're happy to walk through individual family situations because we know there's a lot of variability with COVID. And we always want to fall back on these layers of mitigation. So when we talk about layers, we talk about things like isolation, quarantine, masking, HVAC improvements, increasing ventilation, disinfection of surfaces. All of those things are layered. And we always want to go back to that CDC community level to sort of get the best mix of those for your individual facility and the families you serve. And lastly, we had an exciting update this summer with the littlest members of our community here in Jefferson County, the 6-month to 4-year-old children being eligible for COVID vaccine. And I know many families were really excited for that opportunity, but continuing to promote vaccine, not only for students, but also for staff and any volunteers is definitely one of those most important mitigation strategies that we have. All right, next slide, Christine. So some of this will be repeated. Again, we want to really keep track of the CDC community level, and that's widely viewable online. Always considering that if you have medically fragile children, if you have staff with pre-existing conditions who are more at risk for severe disease with COVID-19, taking care to plan for the safety of those folks is really of utmost importance. And again, that's something that our epidemiology staff is more than willing to have a consultation with you about. We're always willing to set up a phone call, communicate via email, whatever works. There is a link there for the latest school guidance. Again, that will most likely be updated again early next week. So you'll probably get an updated PDF via email, but you can also access it online as well. Next slide. So this is a requirement for COVID-19 guidance that has not changed. One of the few things that hasn't changed in the past several days, and that's that anyone with COVID-19 needs to isolate at home. So away from school, away from work, for a minimum of 5 full days. So I feel like we've done a good job of working with everyone in our community to understand when that count of 5 days begins. But just as a refresher, in that third bullet, day 0 is considered either the date of symptom onset, or if someone is asymptomatic, that day 0 is the date that their positive test was collected, the day the specimen was collected. The earliest eligible return for anybody would be on day 6. And there's 2 criteria, clinical criteria that we use for evaluating if someone is ready to return. And that's if they've been fever-free for 24 hours without using any medication. And we call a significant improvement of symptoms that second criteria. We strongly recommend anyone returning before day 10 wears a well-fitted mask until it's been 10 full days, either since symptoms began or the test was collected with an asymptomatic patient. And again, just that requirement in there at the end that CDPH requires schools to notify their local public health agency, which is in Jefferson County, is us, of any positive COVID-19 cases. Next slide, please. So now we get into some of the things that may adjust based on the information that both CDPH and CDC has come out with recently. So as I said at the beginning, you'll start to notice a shift away from quarantine requirements. So when this guidance was issued earlier this week, it hadn't changed much since we issued it in February. So it was sort of business as usual. I think we didn't get many questions on it because you all are so used to it and so good at implementing it. And you've gotten so great at mitigating COVID that there were no real surprises. So in terms of the recommendation for quarantine, we're starting to move away from that. So previously, we were only requiring quarantine for schools that were in an active outbreak, and I'll get to that in a little bit, or students that had, or staff that had a household exposure of COVID-19 and who were not fully up to date on their COVID vaccine. So you'll start to notice some shifts in the guidance away from required quarantine for those groups of people. Again, a lot of this is hot off the press today, and so our team just needs a little more time to sort of get together and wrap our heads around how we will sort of get our newest, latest, and greatest guidance out, but that will be coming very shortly. So another big thing that came out today was getting away from the recommendation to contact trace in school settings. So the close contact definition is listed here. A lot of you are very used to this, 3 feet or less with a person that has tested positive for COVID. In a preschool and childcare setting, that's usually the whole classroom, because the way obviously that small children move about their day can be quite different than in a K through 12 setting where there's assigned seats and there's not as much interaction, not only among students peer-to-peer, but also between caregivers and teachers and children who are small and need more assistance. So the quarantine definition is up there. Again, the guidance that will be coming out is always guidance that we are happy to support schools, and we do have quite a few numbers of schools who choose to be more abundantly cautious. So we have schools that still require, for example, all students to be out for a minimum of 10 days after a COVID-19 diagnosis. That's something that we support, again, based on facility choice, and we're happy to support that autonomy. But going forward, just understand that there will be sort of a move away from required quarantine. Okay, next slide. So again, the way that the guidance was written earlier this week was that anybody aged 6 months and up who is eligible and up to date on COVID vaccine could continue to come to care if there was an outbreak in their classroom, or anyone that had tested positive for COVID within the past 90 days. So again, we'll be looking at all of this as we sort of refresh this guidance for next week. Next slide, Christine, please. So this is sort of what I was talking about a few minutes ago in terms of family or household exposure. So previously, we would require quarantine for anybody who was not up to date on COVID vaccine, who had a family member, excuse me, or a sibling with COVID-19. So I again would predict that some of this would change for our next reiteration of this guidance as well. I'm catching Christine's cough, apparently.
So sorry.
That's okay. Okay, moving on. Okay, so as I mentioned, many of you that I recognize have been through outbreaks of COVID-19 with us. I want to stress that the definition of a COVID-19 outbreak is not changing. And so this is something that we as JCPH are required to report to CDPHE. They want to be aware of all of the outbreaks of communicable disease in our county. So just to refresh everyone's memory, the definition of an outbreak would be 5 or more confirmed or probable cases of COVID-19. And we now just need one case that has had a positive molecular amplification test or home antigen test. So that could be unproctored at-home antigens, which we know most people utilize these days, or it could be proctored. It could still be a PCR test from a physician's office. All of those are now included. So we need 5 epi-linked cases, which means we can tell during the investigative process that there's transmission happening either within a cohort or within a classroom. If there's a staff meeting where people have gathered, there's a lot of different ways that we could epi-link 5 cases. And again, our infectious disease epidemiology staff will sort of work through the investigative process with you and ask a lot of questions and try to determine if there's epi-links, and we'll kind of move toward opening the outbreak from there if we determine that there is high enough probability that transmission occurred in that particular setting. So again, and I think many of you are so great about doing this already, but just as a reminder, please reach out to us if not only if you have one case as required, but particularly if you start to notice clusters of cases that are popping up within a short amount of time. We want to try to consult with you as soon as we can to mitigate the transmission of the virus further and really keep everybody as healthy as we can. So the outbreak definition, in short, has not changed. Next slide, please. So previously we had required quarantine for anybody that did not meet an exemption during an outbreak in a school. So this is something that we'll be looking at as we make some decisions early next week. And again, schools are always able to and encouraged to be more cautious, especially if you have medically fragile students or staff in terms of this guidance. But this is something that we'll be looking at at potentially revising. And thanks for everyone's patience. Again, the CDC guidance just was hot off the press this afternoon. So we're kind of in flux at the moment in terms of really defining and aligning what the Jefferson County guidance will be as well. So the recommendations have not changed in terms of masking, especially when those CDC community levels go up. And if we have little ones that are less than 3 years old who are unable to mask, the best practice would be to quarantine those kiddos for 10 full days. But again, that's a recommendation at this point and not a requirement. And I think a generic across the board recommendation for anybody after an exposure would be to get tested on day 5 after exposure. That's sort of best practice across the board, even outside of school settings to our general community members. Okay, next slide, please. So some more helpful links. Again, some of these have changed as of today. So I would encourage all of you to especially take a look at the CDPH page and the CDC page, which was just updated this afternoon. There's a lot of good information out there about, again, those layers of mitigation. We have a lot of tools in the toolbox at this point in the COVID response, and our staff would be so happy and so willing to work with your school to sort of apply the tools that best fit your particular families that you serve, your particular environment. I know some of you on the call have been recipients of HVAC awards in terms of grant funds to be able to improve ventilation in your buildings. And we're always available for consults and for advice on how to mitigate not only COVID-19, but all infectious disease. So I want to open it all up, up to more things than just COVID. We want to keep the kiddos that you care for as healthy as possible, especially going into an upcoming respiratory and flu season. So with that, I think that's the end of my presentation. We have lots of staff here from Jefferson County that would be happy to answer some questions. I will hang around. Another thing that before I go, would love to get some input on is how we can best serve you. I know that evening meetings aren't always the easiest to attend. So again, thank you all for coming. One thing that our team has been sort of throwing around is if we could offer maybe bi-weekly or monthly office hours. So we could have sort of an open forum time where you could pop in during your day if you've got burning questions about infectious disease or mitigation. That might be something that we could offer this fall, especially as more kids start to get sick. So that's an option, but I'd love to hear from anybody on how we can best serve you and how we can be available to meet your needs. And again, we're just really happy that you're all here and you took time out of your Thursday evening to come and learn about COVID and what's new. So Christine, do you want to just open it up for some questions?
Perfect. Yeah, I'm going to stop screen sharing here so that I can see the participant list better. We have disabled the chat. However, I think you can still raise your hand, correct, Nikki?
You should be able to, and if I don't see any hands raised in the next minute or so, I'll unmute everybody and then you can mute yourself and unmute yourself as you wish.
And I'm going to go ahead and stop the recording so that we do not record the Q&A session.